All right, good morning, and thank you for creating time for us on this particular Wednesday. On the health segment this morning, it's all about celebrating a cadre of the health sector that is very pivotal when it comes to patient care. They are the ones on the front line most of the time during a health crisis, during disasters, during that time when you're celebrating, you're receiving your bundle of joy, and they are there also in those very low moments when you are mourning the loss of a loved one. They have done a lot. Sometimes they find themselves working 24 hours a day. There are weeks they would find themselves working 7 hours a week or even 365 days in a year because of the demand that this career actually puts on them. I'm talking about none other than the nurses, and it's the International Nurses Week, and ahead of that particular day that is marked annually on the 12th of May every year, we have chosen this morning on Daybreak to celebrate nurses and talk about pertinent issues that they go through or they do to move forward the health sector. And I have 3 nurses with me in studio this morning to speak on behalf of 1,000 and even millions others across the country. Allow me to bring you in on who I'm hosting this particular morning. Sitting just right on my far right there, we are having Margaret Muyuro. She's the head of nursing at the Nairobi Hospital. Thank you so much for creating time. Then at the center, we have Maureen Zioka. Maureen is the national treasurer of the Kenya Union of Nurses. And we also have with us this morning Susan Wakaruigi, the Chief Nursing Officer, the Nairobi West Hospital. Yes. Asanteni sana.
Thank you.
Every time we hear a nurse, I mean, if you ask me, among all the cadres of the health sector, I think nurses are the ones who are like the foot soldiers who are always constantly on the ground. The doctors would come and, go around the hospital and go back to the office or go somewhere else. But the nurses have to be there throughout to monitor and to ensure that whatever the doctors have said is being implemented to par. But I'm not the expert in this, so I'll give you all ladies a chance as we open up this conversation to tell us a bit more about yourselves. And the first question would be for people to understand as we celebrate nurses, who is a nurse? Let me start with you.
Thank you so much for the great question. We appreciate the Citizen TV for finding it fruitful to invite the nurses here. My name is Margaret Muyuro. I'm the head of nursing at the Nairobi Hospital. And a nurse is a person who takes care of you, sees you through during birth, during your lifetime, and even the end time. The nurse can only be described for the work we do with 5 C's. We are compassionate about what we do. We are competent, we are confident, we care, and we have conscience. With this, we ensure all the generations, they are healthy and they live a longer life. We treat them and we ensure we give them preventive messages so that they can live a healthy life. We love our communities, and the nurse is the person you get at the very point of entry point to the hospital. For example, when you go to a hospital, a nurse will triage you. Will involve the other healthcare professionals like doctors, surgeons, consultants, and ensure the work is done to make you healthy. We are the advocates of the patient.
Wow.
We pride in that, and we do it compassionately to ensure everybody live a healthy life.
What a beautiful way to describe who a nurse is. I'm going to give you all a chance to do that because we want to understand the role that you play. Maureen, you are not just a professional nurse, but you represent an umbrella body of nurses in the country. I also want to hear your description of who a nurse is.
Just to add on what she has just said, because she has elaborated into depth. This nurse, a nurse is a person who has gone through a training. And a nurse is a person who has gone through a training and been given the authority to take care of a patient through appropriate regulatory authority body. Here in Kenya, we call it Nursing Council of Kenya, that normally vets us and sees that we fit and we are ready to practice. And again, to add on it, is that a nurse, it gives us the mandate to go out there and see that we can work in our country anywhere, even outside the country. Yes.
Wow, beautiful. I love what you've done there. Just apart from the description of the character and the person that she took us through, you have added, you know, that element of you have to be qualified and certified. Not just anyone is a nurse.
Yeah.
A nurse has to be what she has said and also go to school for it and get, you know, certified for that and licensed for that. All right. What about you?
Thank you very much. A nurse is mandated to care, be responsible, and have very high integrity, honest with the patients, relatives, and visitors, and the colleagues. Now, one special thing about a nurse is she practices autonomy. For me as a nurse, it doesn't matter whether you're white or black. It doesn't matter whether you're a native or an expatriate. It doesn't matter whether you're my tribe or not my tribe. I will care for you because you're a human being. The other thing is that the nurse.
So you don't choose, you're not a respect, like you don't choose based on you coming from this tribe, you earn this much, so I'm going to treat you this way. You're not a respecter of persons and positions.
You are a respecter of humanity, human life. What do nurses do? They save lives and they do no harm. And when we are qualifying, there's something we call candle lighting. We are the light of the world. And we do our vow holding that candle, which is lit, to swear before God and before the assembly that we shall do no harm and we will advocate rightly. So we practice beneficence and non-maleficence, meaning we will do those things that benefit patient 100%. And we will do those things that protect the patient from harm by pointing them out. That is what my colleague said here, that we are advocates.
All right.
Even when the patient is ignorant of their treatments, I am the voice of the voiceless. I will voice it out, either to a doctor, to a pharmacy, to a physio, to whoever team member is involved in the care of the patient. I will stand for that patient and be very assertive and say, for my patient, no. This is the right thing, and it shall happen.
Wow, and that is not easy to do. I mean,
No,
not everybody can become a nurse. Then from what all of you are describing, it sounds almost like a calling, is it? It is, yeah?
Actually, we refer ourselves as a uniformed force, if you like.
Oh, okay.
And we value that, and ours is a noble profession.
All right. Yes. Today you see them all glammed up here. Wait until you see them along the corridors of the hospital, especially when there is a medical emergency. One thing I like is that I'm sitting in a panel of ladies who are leading the nurses in the different health facilities, and also Maureen also being at the helm of an institution that is in charge of hundreds of nurses across the country. So you have the depth of what this profession is all about. I want to understand, as we mark this International Nurses Week, Margaret, what excites you? What does it mean? What is the significance of this season for people who may not know why this is a big deal, why we are having this conversation this morning?
I would like to introduce this week, International Nurses Week. It was started way back in 1965 as we celebrate the founder of nursing, who is Florence Nightingale, who started the nursing back then. Florence Nightingale, during the Crimean War, she walked with a lamp to the wounded soldiers. She used to clean them. She used to walk with the lamp, and that's why she's known as the Lady of the Lamp. And this lamp brought a lot of hope, brought a lot of warmth, which brought the recovery of the wounded soldiers then. And that's the founder of the modern nursing. Nurses globally, we have one association called International Council of Nurses. In 1965, in the reminder or in the memory of our founder of nursing, they designated every year from 6th to 12th of May, we celebrate her birthday and we call it International Nurses Week. This is when we get to recognize nurses who are doing very well. We get to do service to the community. This is why we also bring awareness of what nurses do. And this is how also we empower ourselves. How can we improve our practices so that we can be mindful to the environmental challenges? And I remember when the COVID came in 2020, March, and it was announced a disaster in Kenya by the CS then Health, Mutahi Kagwe. The nurses came together. We did, with our research and experience, we were able to partner with other health professionals, and we are able to save many, many lives. You can imagine hospitals were manned by nurses. Nurses, as we were told, we are regulated. We have different specialities. This is the time we remind ourselves, where are we headed as nurses? And when people take these different specialities, we are able to tackle the environment. So this International Nurses Week, we are celebrating our achievements. We are empowering our generations to come to do research and be able to come with an innovative way of solving health issues. And also we are awarding those who have done very well. And we come together, we celebrate globally. Our theme for this year is nurses. Our international theme for this year, our nurses, our future, economic power of care. You can imagine at every health institution, nurses make 80% of the healthcare system.
All right. Allow me to cut you short on that theme there, because I'd like us to really delve into the depth of it and what it really means, why it's a priority for marking the International Nurses Week this year. But I also like to hear your thought, Maureen. Is it a celebration? Yeah, this year, looking at the nurses in Kenya, do we have a reason to celebrate from where you sit?
Okay, thank you, Safin. I just want to say that it is a celebration for me being a nurse, because I give service to humanity. I'll start from that. I have to look around and see, how have I helped a community? How have I helped someone who was in need and was really in need of me? And then that is where I say we need to we take time, and this is the time that we reflect on ourselves. We look at the achievement. What have we achieved from all this time, and the challenges that we've had as nurses of this country.
All right. So let's go back to the theme, because we're still trying to dissect and understand what the International Nurses Week is all about. And this is where I'll bring you in, Susan. She had just reached where we just wanted to understand the concept of why, when you look at the future of nursing, and this year's theme is tied to the economic aspect of it, just to get it right, our nurses, our future, the economic power of care. These words, what do they mean to you?
These words simply mean that nurses make all the difference. Whether it is economically, because you find most facilities are run by nurses. You will find, say, one doctor or one clinic officer with so many nurses surrounding him. Why? A doctor may give an instruction, but that instruction means that it cannot be accomplished by one nurse. It will be accomplished by several. For example, a patient is in the ward, admitted, and the surgeon comes and reviews and says for theatre. The ward nurse will prepare this patient, will wheel this patient to the theatre. In theatre, she will hand over to a nurse who will receive this patient. The nurse is the one who now remains with the patient 24/7, explaining and allaying anxiety on the patient, and being compassionate and being empathetic with the patient to make sure that the patient, the anxiety is alleviated. We'll hand over to a nurse in theatre. A nurse will prepare instruments, and assist the very surgeon. So if you look at it, it is several nurses with one doctor.
So a nurse is needed everywhere.
A nurse is needed everywhere.
In every stage.
Right from birth to exit, that is at death. The nurse walks in our lives throughout. From life, when you're born, to the time you die. The nurse does not depart from the humanity, from that person, so to say. So when we say that the theme is nurses make a difference economically, socially, physically, spiritually, emotionally, all in one. Nurses are the backbones of healthcare. So a nurse or nurses make a difference to humanity, and it is worthwhile to celebrate nurses. And that's why today we are here to celebrate ourselves, because many times the nurses are not celebrated. So we are celebrating ourselves, and we are stamping the fact that nurses are so key, they are important, and we just need to tell the world that we care, we love them, what we do with passion. And if I talk like in Nairobi West Hospital, where I'm the chief nurse, nursing has gone an extra mile to invest in group counseling of patients. For example, if you have cancer, you may think that I'm dying tomorrow. But when we put you together as a group and we give you hope in form of counseling, the nurse makes a difference in their lives.
So it goes beyond just the medical treatment.
It actually goes beyond giving an injection and giving a tablet to swallow.
All right.
Yeah.
All right. Wow. No wonder I said this is a calling.
Yes.
Margaret, you know, if you look at the level of investment that we have placed as a country on this crucial profession that we say is the backbone of the health sector, you know, what would you describe it to be? Does it help us to really realize the economic or even social benefits that comes with, you know, having nursing as part of the healthcare profession?
Thank you so much, Shafi. That's for the good question. I would like to elaborate about investing in nurses. One of the ideal things to do is to ensure we train enough and we train quality. I appreciate the Regulator Nursing Council of Kenya. They do regulate nurses and train them to serve locally and globally. And also I appreciate the private sector, like the Nairobi Hospital. We have a good school of nursing, Cicely McDonald School of Nursing, which started way back in 1956, and it have been able to have graduates who are serving actually globally. Our nurses have gone beyond the boundaries of Kenya. They are in US, Canada, and Australia, among many other countries, the heavy economic power countries. When you come to Kenya, what is happening nowadays? There is nurses attrition. The US just started the Pearson Examination Center here in Westlands to take our nurses to the US. And they visited us as the Nairobi Hospital because they believe the quality we train our nurses.
So we export?
I'm headed there.
I mean, I'm even concerned.
When it comes,
do we even have enough to begin with?
I will say, Shafi, from where I sit, we have enough.
We do?
But what is happening globally now, you know, some of the heavy economies lost their nurses during the COVID war. They are now starting, the attrition is now at higher rates. I would request the policymaker, the government, let's invest in training nurses. For instance, we have seen countries like Philippines, nurses are trained for free. So this is a call to the policymakers, the government. Can they subsidize fee to train nurses for Kenya so that we can have enough and also export? I know that currently we are having challenges of jobs in Kenya. So if we can train as many, I know currently the School of Nursing, they are doing a great job, but they have a limitation, or how much the finance must so. How much can they be able to train our nurses?
All right.
If we invest in more training of nurses, our GDP will go up.
All right.
Well, so it's a call. We train more, we export more.
That's a challenge you're throwing out there.
Thank
Train
you.
more, have more.
Yes.
Maureen, do you think we have enough?
Thank you, Safin. I want to say that we do not have enough nurses from where I'm seated. Where I'm working, I work with the government.
Yeah.
In every facility, there's a big shortage. And that's why I'm calling out to the government to employ nurses on terms of permanent and pensionable terms. Simply because you've seen they keep on employing nurses on contractual employment, of which it demotivates the nurses. Remember, we are the nurses that we do equal job. We are the nurses who have the qualification are the same. And that's why you find, like the other day, we saw in the Senate, the government already, the Minister of Health had already said that they are going to employ, transition the nurses who are in universal health care to PNP, permanent and pensionable terms. But the CS of Health, unfortunately, pronounced in Senate that Public Service Commission has just advised her that they are not going to employ
So
these
there was
nurses.
About turn
Yes, it was a turn round. They turned around and changed everything.
Was there an explanation of that?
Yes, we have letters that they have written, their commitment letters from the Ministry of Health. They assured us that they're going to employ these nurses. But you see, still the shortage is still there. We are asking the government to stop employing nurses on contractors, despite her saying that we need to train more nurses.
Yeah. Maureen, as you say that, your union has issued a 1-week strike notice.
Yes.
There's a meeting that is supposed to be convened to ratify that strike notice. I believe it should be this week. There's quite a number of issues that your union is saying is pushing the nurses to go on strike. What are these issues?
First, the first issue was of internship. We have nurses who are for internship. These nurses, they were supposed, the Ministry of Health, in terms of the stipend that they had given them, they wrote to the SRC to advise them on it. The SRC reviewed the circular. And what they did.
They changed the initial agreement?
They changed the initial agreement. They gave them the stipends of 35 Kenyan shillings.
What was it supposed to be?
104.
All right.
Again, the other issue of which now the union went to court. And the court gave a verdict of that they need to review, and they gave a stay order. So the ministry has a contempt of court. Again, we have that universal health care coverage that is making us go out because the ministry or the government, rather the government, does not stick to what they have said. They keep on changing their goals. 1 minute they say this, the next minute they're changing, they're saying the other thing. The other thing is about collective bargaining agreement. We have negotiated a collective bargaining agreement with the Ministry of Health with the guidance of Public Service Commission and to the perimeters provided by SRC. So Ministry of Health wrote to SRC, we are still here waiting. It's a month down the line waiting for a letter of no objection so that we get the CBA signed. So we are here wondering why. And why is SRC taking this long?
Yeah. And you have threatened to join the other medics on the current crisis that is going on. The clinical officers, I believe today should be day 38. For the doctors, today should be day 56. Susan, what are we looking at? What should we expect in the coming days if this comes to reality?
I can only say that we are sitting on a time bomb.
Yeah.
the concerned government office is giving a blind ear, a blind eye and a deaf ear to health issues, which are quite important issues to discuss or to bring to the table. Let me say that health is one area that has been neglected in this country, where doctors, nurses, clinic officers, physiotherapists, when it comes to remuneration, nobody wants to discuss it. When it comes to other areas like political space, it is by force, by fire, remuneration is given. Now, and that is why you will find we have nurses who are relocating, migrating to other countries, because locally they're underpaid, so to say. It is not that our unions have not spoken, and that's why they are threatening to go on strike. Now, and this has left individual facilities to look for ways or strategies to retain nurses. For example, like in Nairobi West Hospital, where I work, the strategy that we are adapting is to take nurses and train them. We are actually doing specialty trainings for nurses as a strategy of holding them. And when they finish the training, we are saying that we pay them better because they have acquired more knowledge, and for them to stay with us to give quality care to our critical patients. Because then if all migrate, the Kenyans are being left with who to care for them?
So training and
research.
Pay is non-negotiable for this profession to be really effective and fruitful. I'd like to hear your thoughts on that as well, Margaret, because there's a lot that is going on. Even you had mentioned that currently it seems like there's an exodus of nurses going, to practice abroad because there is a demand on that other side. And she's saying that if we look at how we treat our nurses, this could be one of the reasons probably why many of them would find it easy to accept the offers that come, because they are better pay, the work environment over there could be better. I want you to look at our context in the country, paint a picture for us of, because you had the nurses, you know what it looks like when it comes to their welfare. For a nurse to perform effectively, for a nurse to deliver what she's supposed to deliver in terms of healthcare and patient care and all the good things that you had started by telling us nurses are doing in hospitals, what is it that should be done to ensure that this nurse is equipped to do exactly that?
Thank you so much, Shafi. A very, very pertinent question. I'm so humbled. I did my training at the Nairobi Hospital way back more than 2 decades ago, and it was quality training. And I appreciate the Nairobi Hospital. Let me start from the private sector. What has happened to Nairobi Hospital? They give you good training, and after that, they give you a job to work immediately. When you get to the clinical areas, you get very, very clean environments. You also get resources which help you do your work. We also empower you as you continue to practice with more knowledge. We upskill you. We ask you, what is your passion? If you started as a staff nurse, would you like to be an emergency nurse, critical care? We empower you with knowledge. As times go on, you are promoted to different levels, and your salary is increased according to the training and the experience. Nairobi Hospital enables us to serve in international globe. What do I mean? They do sponsor us for conferences internationally. And most of us, we have gone to various countries like UK, Australia, Japan, USA, Canada. We just had one of us come last week from 49th Oncology Conference, which was held in Washington, D.C. Our hospital have invested heavily to our nurses.
So how do we borrow this lesson? Because there's a Kenyan who's watching you, Margaret, this morning, and they may not be having that luxury of coming to Nairobi Hospital. They may not even afford to, get their health services there. They want to go to that public health facility and find a nurse who is motivated, who is empowered, who is well equipped. How do we change the narrative in the hospitals where a majority of Kenyans go to on a regular day?
Shafi, I have been a board member at the Nursing Council of Kenya, and that have been our conversation.
Yeah.
And also as we develop the strategic plan of nurses of this country, where I sit as a committee member, the technical working group. When health was devolved, and now it belongs to the county government. Our call is to all our governors. We are requesting them. They should invest in health. Let them train the nurses, offer them good working environment. For instance, how do you attend to a patient in labor without gloves? We have to take care of infection control. How do you give quality care when you don't have the medicine to administer to this mother who is in pain? Our governors must invest in health so that we can make a difference. When it comes to salaries, I have colleagues who work in government hospital. Some of them, they do call us, tell us their salaries are delayed. They have many challenges. There are floods. We need to take care of our human resource in health. We need to invest in this, and from where I sit, I would request maybe the county government, all of them, the health budget should be different from the other budgets, so that when we have emergencies, they are able to attend to issues immediately. For instance, when it came to explosion of gas in Embakasi, we saw private hospitals like the Nairobi Hospital. We went on the ground. We have a disaster kit where we went, attended to these Kenyans who needed help for free. We camped there in Embakasi for 2 weeks, giving health care with a difference. The same thing we request the governors. Could they set a disaster kit or healthy kit for all the profession so that we can always be ready to serve our patient right?
All right. Maureen, the experience of a nurse working in the public sector, run me through, that work environment and the experience that nurses in the public sector have, and what needs to be done to change the narrative.
Thank you, Safid. I want to say that there's a big vacuum in the public sector. A lot needs to be done. My colleague having said that we want them to emulate what the private sector has done yeah. and still is doing, because that is where we see health facility and the services that they give are top-notch. And remember, these are human beings that we serve. And we've seen that even having these gaps of shortages, we don't have drugs, we don't have materials to use when working, we have to improvise. You see, and the government, we are being told every now and then there's a budget that has been set aside for all this. Then we keep on asking ourselves, what is really happening? Where is this budget? Where is this money? Where are these instruments that we are lacking that we need to have? Where are these tools that we need? Where are we lacking? So that's why you find there's a big vacuum in the public sector. There's no comparison with the private sector at all. Yes.
All right. There's this pressure that has been on your side right now, especially when the doctors and the clinical officers have been out on the streets. How has it been like, being in hospital? Now you guys are threatening to down your tools. You will leave us stranded if that happens.
We've been, from where I'm seated and where I work, what I can say, we've been lacking that specialized care. By specialized care, I mean like I'll need a consultant to review a patient. Maybe a patient has come in and will need his attention, but I will not be able, I will not be able to give that service because the law limits me to what I'm supposed to do, because where I work in a level 6 hospital. But those who are in level 2, level 3, they are able to give these services. But even the referral system is also different, because they also need to refer, like in KNH and KU and other hospitals, where we find there are no doctors, but nurses are there. We are doing our best to give these services to the community. Yes.
I don't know whether it's a good thing or a bad thing in Kenya. Even a nurse is a doctor. So a Kenyan would go and say, nimeonwa na daktari. I don't know whether that's a good thing or a bad thing, but at least when you go to a health facility, even at a time that we have such a crisis in the health sector, you'll find somebody who can attend to you.
Yes.
Maybe the level may get to an extent whereby that person may not be able to go beyond what they can do, but at least you will find somebody at the health facility who can attend to you. So having said all that, ladies, Susan, as we mark the International Nurses Week, what should be the priorities that we put on the table and say that these issues are a must address for us to really say that we acknowledge and celebrate nurses and we know what this profession, means? What should be the priorities?
Thank you, Madam Shavil. Now, number one priority is recognize the nurse holistically. What do I mean? In this country, it is very expensive to train a nurse, and especially from basic to specialty. And today, parents and those who wish to become nurses are actually struggling to have them trained. And that's why we have this shortage. Many children would want to become nurses because they have the calling, but they cannot afford. So number one is, can the government make it possible for nurses to train? Yeah? Can they give grants? Because the same way we care for security, a police officer will train without having to pay for it. An army officer will train without having to pay for it. Can a nurse train without having to pay for it? Before, long time they used, many years back, they used to do that. So once this nurse has trained and has started working, can the nurse get paid? A nurse is a very important specialist in their own right. They are with the patients 24/7, yet they are underpaid in this country. And when we voice out, it is just empty promises, empty promises. In fact, the nurses who are paid at least better, but not what they deserve, are nurses who work in the private sector. But when you go to
have a long way to go even.
We have a very long way to go, both in the government and also in the private. The nurse remains underpaid. So number one, help the nurse to train by them attending to colleges, and it is paid for by the government because they can afford. Then let the nurse be well paid for the work they do. And by the way, sometimes I keep quiet and I see what nurses do and I wonder, can somebody really pay a nurse? That is a question for another day to be answered.
Do you think they can be fully paid and rewarded for?
They cannot be fully paid, but they can be rewarded.
Okay.
Because sometimes we are...
I'm just wondering, and I don't know what you think, if they're decrying of salary arrears and even their terms of service and, lack of payment of the salary for the work they have already done, can the government really afford to give them grants for training and train them for free? Do you think that's possible? Salary is an issue.
This is about lawmakers and representation. I would urge nurses to get representation on the table at the government level. If we have presentation there without being represented by another specialty, our issues will be well handled. So I would urge all nurses, wherever they are, get representation, either in parliament, and let's present our issues, because they are quite huge. And it is not just about our issues, it's about what we need to give quality care to patients. My colleague has talked about assisting a mother to give birth without gloves. How? How then do you tackle infection control issues? We afford this because we are in private. I have everything in Nairobi West. I can give care to any patient. I have all the consumables at my disposal. But when you go to a county hospital, a patient comes bleeding, there's no blood, there's no giving set to give blood, there's no needle or there's no medicine to, you know, all that is what we are talking about. Every patient in Kenya deserves quality care, whether I'm in a government hospital or in a private hospital.
Health is a right, it's a human right.
It's a human right. Yeah. And this is what nurses are struggling with. We know we are passionate about what we need to offer, but the resources are not given to us.
All right. I just want to interest you in some numbers that came through. This was a report done in it was actually released in 2013 by the World Health Organization. It's dubbed No Health Without a Workforce. And this report was indicating that 44.6% of the 186 countries with available data, which means there are countries that their data is not out yet. So 44.6% of the 186 countries did not meet the minimum threshold of 22 point something skilled workers, which include doctors, nurses, and midwives per 10,000 people. And Kenya is among these 44.6%. This is almost half of the countries we are talking about. And we are having this shortage of, I would call them the health professionals. Yeah? I mean, what do we do to bridge this gap? Because this is a sector we cannot choose to ignore. I'm not saying there's a sector we can ignore, but this one, this is a sector we don't play with. These are human lives we are talking about. And if we look at reports such as this that tell us that we are not even halfway, you know, meeting what is supposed to be there in terms of what can give us value for the input we put in the health sector, what do we do?
Shafi, a healthy country will give us a healthy economy. We must invest in health. How do we invest? We start with the human resource. How do we build capacity of all healthcare workforce workers? Let's expand the training schools and give subsidized fee, or if it's not free. And we start with nurses because they are the largest workforce and the backbone of every healthcare system. 2, we must put our priority right in this country. Health is devolved, but we must know how do we budget as a country so that we can be able to treat people well, so that they can impact back to the economy. When we look at the developed world, their life expectancy, if you allow me use the USA, they're at 85 to 89 years. When you come to Kenya, we are doing 71 now, life expectancy. What does it mean? That productive professor who could have lived longer to 89 years and become more productive by training, by empowering the young ones, they die at an early stage. Can we invest in health? This will give us a healthy economy, and we will lift up our the life expectancy, and no more of these comorbidities we see. People getting diseases like hypertension, diabetes, cancer, being diagnosed at the fourth stage will go down. And things like sick days will reduce to our employees because they are able to access health care at the lowest level and get the right treatment and the right time. This will make us a working nation, not a sick nation, a healthy nation, and a wealthy nation.
All right,
Thank you.
That's a beautiful dream. Maureen, any additions on how we can realize that beautiful dream? That's a beautiful one.
Yes, mine is that just say, it's like I don't want to do a repetition because that is what we expect the country to have done. And we thought the new government in place, when they came in, they had promised us that they see the challenges in the health sector and they're going to invest in health sector. But up to date, we haven't seen anything that has been done. They have not even employed nurses. Where I am, do you know nurses are so much demotivated because even promotions, nurses have stagnated more than even 13 years in one job group. They are not able to promote these nurses. And promotion means it's salary increment. It means it's money that is needed. When we attend to this patient, do we generate money? We do. So we wonder, what is it that the country expects of us? How do you motivate me? How do you want me to perform my duties? How do you want me to to see our country grow or rather be in a healthy state? Right now you can see we have calamities in the country, we have floods. We are doing volunteering jobs, we are going there to help. But you find that we are not getting the resources that we need. Why? Because the government, we feel that doesn't see the need of investing in the health sector. And we are urging the government to turn their heads and focus on health sector. Yes.
Right. So this conversation we have been having as we gear up towards marking the International Nurses Day on the 12th of May. It's an annual event that usually we get to shed light and focus on this pivotal profession. And you have had your say, ladies, and now we understand the good side and even the bad side of being a nurse. As we wind up this conversation, Susan, would you change your profession based on what we have talked about? You know, as your parting shot, I just want you to
even in my next life, I will be a nurse.
Regardless.
Regardless. Because I am very passionate about nursing, and it gives me a lot of joy when I attend a patient who is critical, gets better, and I am saying, bye-bye, go well, get well soon, and reminding them to come for the appointment. At my level now, it gives me a lot of joy when I mentor a nurse from staff nurse to senior staff nurse, to senior nurse, to a charge nurse, to a deputy CNO, and finally hoping that that nurse can become CNO. Leadership in nursing, research in nursing, gives me a lot of joy.
How many years?
How many years I've been a nurse? Over 25.
Wow.
Yes.
And we celebrate you.
Thank you.
Yeah, Maureen, your final words?
Mine is just to talk to the government of the day. We have issues, like we want them to sign our collective bargaining agreement. 2, we want the multi-sectoral committee to embark and review what they had seen. It's unattainable and unlawful to give to our universal healthcare nurses, and transition them to permanent and pensionable terms of employment, so that we can grow together. And we should not be having 2 teams in a shift. One is so much demotivated, the other one is motivated. We want to work as a team and move forward and build our country. 3, about the internship. I wanted to say about the internship. Let them review the matter. Us as a union, we went to court, and we are waiting for the Ministry of Health to make sure they give them the money that they deserve.
Right.
If today you are given 35,000, this is your child, you've sent them out there, maybe they've been sent to Wajir from Nairobi, deployed there to do the internship. How do you expect them to travel up to there, survive from there with 35 Kenyan shillings?
Right.
So we are asking the government,
35,000
Kenyan shillings. So we are asking the government to look into it and see the good of what health sector means, what a nurse, who a nurse is, and what a nurse does. Yes.
All right. Thank you, Maureen.
Having said that, there's something I would want to...
Allow me to, before my time is up, to also give Margaret a chance, and then if we have extra, Margaret, you're fine.
Thank you, Shafi, and thank you, Citizen, for hosting us. My parting shot is to tell Kenyans to have confidence in nursing. We continue and promise to give them quality care from the private hospitals, from the public hospitals. We are here for them.
All right.
I congratulate all my colleagues for making the right decision for joining nursing profession. This is
the right decision.
Yeah, yes. This is the right decision they made in life. We will continue to serve the people, and we acknowledge the work nurses do.
All right.
They give the whole of their life to serve humanity. Despite working different hours, different shifts, we are always excited to see patients doing very well and going home smiling. We are here for you, Kenyans. We continue to serve you. And I would like to recommend Nairobi Hospital because we give back to the community.
Thank you so much.
If you allow me mention this, many people may not know, we do charity treatment for chronic myeloid leukemia, CML, a project known as GPAP. Wherever you're watching us from, locally, globally, if you have a patient, kindly send them to the Nairobi Hospital Oncology Center. We will be able to give you quality care.
Thank you, Margaret.
Thank you.
All right, thank you so much. Susan, you had something.
Yeah, I just wanted to tell nurses out there that we wish them all the best, and we are grateful for the work that they are doing to humanity. Just know that we appreciate you, nurses, for who you are and what difference you make to lives.
All right, thank you so much. And that is how we wrap up this conversation. Of course, celebrating nurses this particular morning. A lot has been said, and I just really think and I hope that wherever you have been watching this conversation from, you've been inspired. In case you are thinking of joining this profession now, you know what to do and what to expect and how to navigate. But the bottom line is it's a calling, and it requires a lot more that you will have to give the society, more than even what you yourself you're going to get. So that should help you weigh in. I've been having this conversation with Susan Wakarigi. She's the Chief Nursing Officer at the Nairobi West Hospital. And we also have Margaret Muia-Yuro. She's the head of nursing at the Nairobi Hospital. And this morning I was also joined by Maureen Zioka. Maureen is the National Treasurer, the Kenya National Union of Nurses. Thank you so much, ladies, for creating time this morning. And that's how we wrap it up. Thank you so much also for watching the show since we started at 6 a.m. in the morning. For now, it's a wrap, but continue watching Citizen TV. We have a lot that we still have lined up for you.